SRMS जैसा कि आप लोग जानते हैं बहुत ही फेमस मेडिकल कॉलेज है, पूरे यूपी का नहीं बल्कि पूरे इंडिया का, जहाँ पर बहुत ही डिफ़िकल्ट एंड कॉम्प्लिकेटेड सर्जरीज का ये हब बन चुका है एंड मोस्ट ऑफ द पेशेंट्स आर बीइंग रिफर्ड एज अ हायर सेंटर टू अस. Now this patient came to me with chief complaints of dribbling of watery discharge from a nasal cavity, and she also had complaints of headache. On bending, the discharge, the watery discharge was seen profusely dribbling out of the nasal cavity. She was being treated, earlier she was being treated at Haldwani for 3 months, but though she was treated conservatively, but there was no good results for her. So she was referred to higher center from Haldwani because maybe they must not be having any exposure to this surgery. So this patient was diagnosed by me as a case of spontaneous CSF rhinorrhea. It's a rare entity because most of the CSF rhinorrhea are traumatic in origin, but this was a spontaneous one. And for spontaneous CSF rhinorrhea, first we give a trial of conservative management, but she was also given the same, but she was not benefited at all, and then she was referred to higher center. I think it was Delhi AIIMS. She then went to Delhi AIIMS, but because of non-availability of dates over there, she decided to come back at SRMS. And here that's why I will give you just the gist how we treated this patient. We first, though we knew that this patient was given 3 months of trial, and with all the precautions, and beside this estrazolamide, we also gave her IV antibiotics, and she was at least we gave her for I think 5 days, but again there was no improvement. So we get her MRI done, and CT Cisternography was done. She was having MRI from Haldwani, and CT Cisternography was done from our side at SRMS. Now this patient, as I told you, there was a leak in the cribriform plate area, and since she was not benefited by conservative management, we planned for the surgical treatment, surgical intervention. What we did under GA, we did a diagnostic nasal endoscopy. We could appreciate the CSF leak from the cribriform plate area. We decided, since we could locate the site of the CSF leak, so what we did, we straight away took away the fat graft from her thigh, from her lateral aspect of thigh. The fat was taken, and thereafter, after taking the fat, what we did, the inferior 2/3 of the middle turbinate was excised, and this was excised only to take a mucosal graft. After excision of the middle turbinate, what we did, we removed the papery thin bone that is in the turbinate, and the mucosa was harvested. Now, since we were having a fat graft from the thigh and a mucosal graft from the middle turbinate, now we started our surgery. First, what I did, I just from the site of leak, the mucosa, I freshened the margins of the mucosa where I could see the leak of CSF, so that I could be sure that this exactly is the site, and I did a diagnostic nasal endoscopy to locate whether it is coming from single site or from other site also. Now what I did, after freshing the margins of the mucosa from the cribriform plate area, the fat graft was put in a dumbbell shaped form, half of it at the site of leak and half of it in the nasal cavity. After doing this, what I did, the mucosal graft which I took from the middle turbinate was placed over the fat graft that was in the form of dumbbell shape. Now this mucosal graft was, after placing the mucosal graft, what I did, I put again a layer of fat over the mucosa. So I covered this defect in 3 layers, that is fat, mucosa and again fat. And after all these things, after placing all these 3 layers, what I did, I reinforced my support with the help of this gelatin, with the help of fibrin glue. And it was such a nice seal, it was such a nice repair that there was not even a single droplet of CSF was seen. I packed, after repairing this defect, I packed the nasal cavity with Marosil and kept the patient in the ward for 3 days with Marosil in situ, and this Marosil was removed on the 4th post-op day, and thereafter what I did a diagnostic endoscopy so that I could see how effective is my surgery or how effective is my approach towards this patient. Then after that, I called this patient, I discharged the patient, I called this patient to come after 1 week. But as the patient was non-compliant, he came after 3 weeks. Though this is a good sign, if you are not having any complaint from the patient and the patient is not reverting you back earlier, it means that the patient is happy and the results are really good. But this should not be practiced by the patient. So what I did, I called this patient after a period of around, I think it was 3 weeks later. And I did, when the patient came, I did diagnostic nasal endoscopy, and with the help of God and because of my efforts and with the help of Almighty, there was a complete seal. Patient was happy. There was no problem. This is all what I want to say. Thank you.